Empty markets, fewer cars on the roads and advisories to work from home in many states in India. Airports are now shut to all passengers travelling from the European Union, Turkey, the UK and Gulf states. This includes Indian citizens. The country's health ministry says there is no evidence of community spread, even as total positive coronavirus cases have crossed 150 in India. WHO has also lauded India's efforts. Dr. K.K. Agrawal is a former president of the Indian Medical Association. He fears not enough people are being tested.
I don't know the real figure because there are 3 deaths, and 3 deaths would mean that numbers reported are less. I think the government policy today of restricting testing only for symptomatic. So we will be missing all the asymptomatic cases, and so real numbers we don't know.
The Indian government believes most infections have been imported or passed on by direct contact with someone who has travelled outside India. India says 276 of its citizens are infected outside the country, the majority of them in Iran. India had already stopped arrivals from China, Italy, Iran, Spain, Germany, France and South Korea, and borders with neighbours have been shut. Measures at home are also becoming stricter. As cases of coronavirus rise in India, various state governments in India started to give advisories to shut shopping malls, cinema halls, even schools, and to avoid large gathering. Indian stock markets have been bleeding and businesses brought to a standstill. But jewellery shop owner Mayanka Agrawal says more stringent restrictions are needed, even as her own business dries up.
The markets are totally deserted. People have stopped stepping out, So definitely the business is very slow. I definitely feel that a shutdown will be a good idea, at least for the next 15 days, so that, we can be sure up.
The next few weeks are critical for India as it works to limit contagion among residents of its densely populated and highly polluted cities. Shweta Bajaj, CGTN, New Delhi, India.